There are many misconceptions about schizophrenia. We hope that by revealing some of the myths surrounding the disorder, and by talking about its symptoms, that you will have a better understanding of just what schizophrenia is.
The first myth about schizophrenia is that people who have schizophrenia have multiple personalities. People with this disorder do not have multiple personalities, but rather it appears that schizophrenics have one personality that is shattered. Multiple personality disorder, today known as dissociative identity disorder, is an entirely separate disorder that has nothing to do with schizophrenia. It is estimated that 40% of police officers and half of the population believe that these two disorders are the same, and movies like Me, Myself, and Irene depict schizophrenics as having multiple personalities. The confusion may come from the origin of the term schizophrenia, which means split mind, and can therefore be easily confused with having multiple personalities. This splitting, however, refers to a divide in psychological functioning, such as a split between mood and thought.
The second myth about schizophrenia is that schizophrenics are dangerous and violent. Most individuals with schizophrenia are not vicious psychopaths who are a threat to other people. Actually, they're usually only a threat to themselves and at more risk of being harmed by others. It is estimated that 75% of films depicting an individual with mental illness shows that person to be aggressive or even homicidal, and 85% of news stories that cover ex-psychiatric patients focus on their violent crimes. Because of the portrayal of the mentally ill as prone to violence or as murderers, when people hear about mental illness, they think about violence. It is estimated that 80% of Americans believe that those with mental illness are prone to violence. However, research has shown the opposite. The amount of murders committed by those with mental illness has actually declined over the past 4 decades. 90% of people who suffer from mental illness, including schizophrenia, never commit any violent acts, and only 3 to 5% of violent crimes are committed by those with mental illness. Individuals with a mental illness are more likely to be the victims of violent crimes and not the perpetrator. Approximately 40 to 60% of those with schizophrenia attempt suicide, and around 10% succeed. This makes them 15 to 25 times more likely than the general population to die from suicide.
Now that you know what schizophrenia is not, we will tell you what it actually is. Schizophrenia is an extreme kind of abnormal behavior that encompasses what is commonly known as madness. It contains psychotic symptoms that indicate a loss of connection to reality. This disorder affects approximately 1% of the population of Canada. Symptoms fall into 3 broad categories: positive, negative, and disorganized. Positive symptoms are those that appear to reflect an excess or distortion of normal functions. The name of these symptoms is misleading, as they are not really beneficial to the individual who has them. Positive symptoms occur when the individual experiences an excess or distortion of normal functioning, that is, they are added to normal behavior. Positive symptoms include hallucinations and delusions. Hallucinations are defined as sensory experiences not caused by actual external stimuli. In other words, people can hear, see, feel, smell, or even taste something that does not exist outside the individual. Most common are auditory hallucinations, where individuals hear voices, sometimes giving them instructions or orders, or commenting on their actions. Visual hallucinations are also very common, where the individual will see something that is not there. Hallucinations are defined as sensory experiences not caused by actual external stimuli. In other words, people can hear, see, feel, smell, or even taste something that does not exist outside the individual. Most common are auditory hallucinations, where individuals hear voices, sometimes giving them instructions or orders, or commenting on their actions. Visual hallucinations are also very common, where the individual will see something that is not there. Delusions are defined as fixed and inflexible beliefs that are held despite the fact that they may be outrageous or absurd. People with schizophrenia will generally defend these beliefs, even when given evidence that these beliefs are not true. These delusions typically take up a lot of time and energy, and distract the individual from everyday tasks and activities. Some common delusions are the belief that thoughts are being put into one's head, that the person's thoughts can be heard by others, or that the person is being controlled by outside forces. There are many other types of delusions, including Erotomanic, where the person believes someone is infatuated with them; Grandiose, where the person believes they are incredibly important, as they may think they have made an extremely important discovery, or that they are a god or some other religious figure; Jealous, where the individual believes that others are unfaithful or are betraying them; and Persecutory, where the individual believes that they are being spied on, followed, drugged, or harassed by others.
Negative symptoms occur when the individual experiences an absence of normal functioning. That is, there is something missing or taken away from their behavior. There are many kinds of negative symptoms. One of the most common negative symptoms of schizophrenia is blunted affect, where the individual does not show or feel any emotion. That is, they seem to be indifferent to their surroundings and are expressionless. Another symptom is anhedonia, the inability to experience pleasure. But unlike blunted affect, the person can still feel unhappy or sad. Avolition refers to the loss of willpower. A person suffering from avolition becomes apathetic and ceases to do anything for themselves. They lose their independence and usually stop working towards their goals. This can be evident by a lack of bathing, eating, or social interactions. One final negative symptom of schizophrenia is alogia, where an individual will experience reductions in speech, and sometimes they won't even speak at all. The final category of symptoms is disorganization. This includes behavior that is bizarre and strange and seems completely out of place. The individual may exhibit disorganized speech. For example, they may string together random thoughts and words which appear to have meaning but carry no actual significance. This is referred to as word salad. An individual may also repeat a single word or phrase. Disorganized behaviors include rigidity, where the person will remain in a fixed position, overactivity, where the person will engage in purposeless pacing or repeated movements, and inappropriate affect, where the individual will display behaviors or emotions that do not match the current situation. An example of this might be laughing at a funeral. As a disorder, schizophrenia does not have a single presentation, but is a spectrum disorder, with individuals presenting quite differently from one another and having different levels of functioning. There are, however, broad categories. 3 major types are paranoid, disorganized, and catatonic. Paranoid schizophrenics experience delusions of persecution and are also preoccupied with frequent paranoid auditory hallucinations. Those with the disorganized type of schizophrenia have disorganized speech and behavior, and flat or inappropriate affect. Catatonic schizophrenics exhibit a loss of movement or move constantly and repetitively. They may also be unaware of their surroundings. The symptoms of schizophrenia are often associated with an inability to block out sensory stimuli, such as sights, sounds, thoughts, and feelings. We will give a short demonstration of our interpretation of this experience.
Jimmy, and they're totally opposite, right? And so I was standing there and I was like, what the frick?
Are you serious?
I'm just not believe that they put together. I mean, ew.
Your parents don't love you.
Who would even go there, Jimmy? And Carol, I mean, she was sitting where they were. Are you missing me? So I didn't do it. I was walking down the street and I saw them holding hands and I was like, what the heck? Let's do this. You know, are you serious? And then and then
Treatment for schizophrenia is tricky. There are no cures. There are, however, medications that will work for some people, but do nothing for others. Even if a medication does work, it needs to be constantly monitored by a medical professional and can carry horrible side effects like excessive weight gain, seizures, involuntary facial twitching, and fatal heart attacks. While there are some people with schizophrenia who do lead successful lives, it is a very difficult disorder to live with, especially with the many misconceptions surrounding it.